All right, guys, today we're going to talk about prevalence and a little bit about testing of Lyme disease. So every year there are 20,000 to 30,000 confirmed cases of Lyme disease reported to the Centers of Disease Control. In many cases, transmission is not known to the host. The actual number of people infected annually is much higher than reported due to several different factors, such as every bite doesn't mean or equal the bullseye rash bite that you may receive from the bite on your body. Just because you get bitten and get Lyme disease does not mean you'll get the bullseye rash. There are also several co-infections, as I mentioned on my previous video. There's not just Lyme disease. There's, Bartonella, Ehrlichia, all kinds of different things that you can get from these blood-feeding insects, tick-borne relapsing fever. The list just really goes on and on. There's babiosis, really all kinds of different things. So it may not present itself the same. The symptoms may overlap on these tick-borne illnesses. However, it may not present itself even at all. You may not see anything. It may present itself years later in some symptoms of some kind, and that could range from anything from malaria-like symptoms to flu-like symptoms to arthritis-like symptoms to mood symptoms. So there are 25 times more dogs diagnosed with Lyme disease annually in the United States than people, or as compared to people. In the southern United States, 50 times more dogs. So I had joked with a friend I should go to a veterinarian to get treatment for Lyme disease because I'm not getting much help from my regular doctor. All right, guys, so in 2018, I basically was headed to or from the gym, and I remember my thigh was itchy, my right thigh, and I was itching it, and it felt like there was kind of a bump there on my skin. So when I got home, I kind of inspected it, and there was, something about that big on the bottom right thigh. Went to the doctor claimed it was cellulitis. He gave me antibiotics. I can't remember if it was doxycycline or ciprofloxacin. So I actually waited a couple days to take them. I assumed I'm young and healthy, this will go away on its own. It didn't. It got bigger, and my symptoms, I didn't expect symptoms from skin rash. I all of a sudden got symptoms. I felt like I was 80 years old and I was bedridden. I started taking the antibiotics and I felt better. I couldn't believe it, from a skin rash, I was bedridden and feeling like I'm 80 years old. I couldn't figure it out. But then the skin rash developed into a bullseye rash, and that's where I started to piece it together. So after the initial bite, a few months went by, and I remember I was lifting weights and I hurt my wrist and it just wouldn't heal. Slowly, I just started to have more and more negative health events, and I just couldn't figure out why. I was healthy, but yet I was going to the emergency room for random things. One of the times I remember I went to the emergency room, my white blood cell count was 11,000, and I think they said it shouldn't have been over 8,000. I showed the doctor the bullseye rash, and he basically said, yeah, that's Lyme disease for sure. However, I couldn't get a blood test to say that. I went on and I took 2 more blood tests. I couldn't seem to get a positive test for Lyme disease. I went to an infectious disease doctor, and she said that I had mono and stuff like that. So couldn't get a positive test result, and without the positive test result, really there is no treatment. So my first attempt to cure Lyme disease was basically doxycycline. I'd read everywhere you take doxycycline and it kills your Lyme disease off. Come to find out later, it doesn't necessarily do that, that you'll have it still hiding in your body in some shape, form, or fashion. So I wanted antibiotics at the time. However, this was the best that I knew how to treat my illness to my knowledge at the time. I couldn't get antibiotics prescribed to me long-term because I couldn't get a positive test for Lyme disease. So basically I switched doctors a few times until I found somebody that listened to me and looked at my pictures and looked at my blood work, and they believed me. So they gave me a couple months supply of doxycycline, but I really couldn't take it all the time because it bothered my stomach. I tried to add probiotics and eat healthy, and it just wouldn't do it. Couldn't get it done. I was taking them probably on and off for about 6 months or so, and it just made me feel sick. You know, I was trying to add in supplements and stuff like that as well. So later on in my journey, I found that the antibiotics may have been working properly in killing off the Lyme disease. However, they're making me feel sick because when the bacteria dies, it creates what's called a Herxheimer reaction, which is the toxins, you know, polluting your body and making you feel sick. So, I mean, you could compare that to a hangover. You're killing that bacteria with the antibiotic, it's dying, and you feel sick from it. So you may be confused between symptoms and a Herxheimer reaction. I mean, it can be a confusing ordeal. So I guess, you know, the reason I bring that up is, you know, I have heard of some people beating, or they claim to have beaten Lyme disease with the long-term antibiotic usage intermittently. And by that, I mean, they might take them for a couple of weeks and then stop until their symptoms pop back up and then take them again. Or they may take them on and off every few weeks or every month for a certain period of time, and they may do this for up to a couple of years. So to summarize, the goal with the intermittent antibiotics would be to hit the Lyme disease bacteria every time you have symptoms long term, 2 years, every time you have symptoms, hit them. That's basically a summary of that. You know, I've used supplements, you know, like natural organic supplements since my early 20s. I've done a little research on them since then, on and off. I've used them for things like asthma and dry skin and things like that, maybe stomach issues or whatnot. But basically, you know, I researched supplements for Lyme disease, and it was similar to antibiotics where it was hard for me to tell if it's working. I didn't know how long I would have to take this kind of stuff. So basically, I researched every different supplement I could come up with, and I went and got them. You know, it was probably like $100 or more for all these different supplements. And I did make a little list of them there. So, I mean, if you guys want to follow along and pull out your little notepad, you know, I will just mention these, and you guys can kind of look up their benefits. So, I mean, I took things for specifically Lyme disease, such as cat's claw, black walnut hulls, sweet wormwood, teasel root, propolis, it's made by bees, turmeric, it's a spice and helps with inflammation, coconut oil helps to reduce yeast in the body, CoQ10 helps with mental clarity, zeolites helps remove heavy metals in your body. I took lion's mane for cognitive function and ability. That's a type of a mushroom. I used fish oil for my skin and also for omega-3 fatty acid oils. I used vitamin B. I used the acronym is NAC, N-A-C. It's created by onions. It's a very powerful antioxidant. It works amazing for asthma. I would put that one down. That's one of my favorites. Zinc is great. GABA, G-A-B-A is the acronym. That's also for mental clarity. So it's hard to tell which one of these works since I took so many of them on and off. You know, I don't really have an accurate opinion on them, but I do feel that supplements work and they're very powerful. It depends what you're using it for and how you're using it, but I do feel they have a lot of potential. So another thing I found was that I read Lyme disease can rob the body of zinc, potassium, and magnesium. So another thing that I used quite often when I was really struggling with symptoms and during treatments it's called a Myers cocktail. Basically a bag of vitamins. You know, you get a liter of saline with a cocktail of, you know, B vitamins and zinc and magnesium and vitamin C, I believe. There's a cocktail of vitamins in this Myers cocktail. It's a very common mixture, and basically I would go from feeling, you know, down, low, tired, kind of depressed a little bit to having it perk me up and have me feel better for sometimes a couple days. And it didn't work every time, but it did help, you know. So I definitely recommend the Myers cocktail. I think the cost is around $200, just so you guys know. And so I guess that's pretty much it for this video. I have several different videos based on my book and also different co-infections. I'm working on other books as well related to tick-borne illness. So Please subscribe and follow along. If there's any content or information related to Lyme disease that you're interested in, you want me to cover, please put it in the comments. Thank you very much.